A peak flow meter has been prescribed for your use on a regular basis as part of the overall management of your respiratory condition. Thank you for making TruZone Peak Flow Meter your personal choice. Peak expiratory flow is the fastest speed at which air is forced out from the lungs after taking a deep breath. This measurement is useful in detecting changes in airways that could signal a worsening of symptoms or improvement in breathing function for people with respiratory conditions such as asthma or other reactive airway lung conditions. For people with asthma, your condition can change in response to triggers such as cold weather, dust or pollen, exposure to smoke, or even exercise. Regular monitoring of peak expiratory flow can help you detect these changes and respond according to your asthma action plan. TruZone PFM is an important part of your asthma management program and provides many advantages for measuring your peak expiratory flow. Your TruZone Peak Flow Meter is small and portable. It's easy to use, and there's nothing to assemble. You can easily hold your TruZone Peak Flow Meter without blocking the airflow or obstructing its fully protected sliding indicator. TruZone is a one-size-fits-all peak flow meter that can measure peak flows from 60 to 800 liters per minute. In other words, the same TruZone Peak Flow Meter can measure both low and standard flow rates, and young children and adults can successfully use the TruZone. Children as young as 5 years old have been able to use the peak flow meter successfully. The unique spacing of the numbers on the TruZone PFM scale is logarithmic, which makes this possible. Here at the lower end of the scale, the numbers are spaced in such a manner as to make small but important changes in a person's reading easy to see. At the upper end of the same scale, the numbers are displayed similar to standard range peak flow meters. Lastly, our patented color zone tape securely establishes asthma management zones without cumbersome calculations. Now, let's take a look at the proper procedure for use of your TruZone Peak Flow Meter.
If at all possible, the patient should be standing when using the TruZone PFM. If not, an upright sitting position is best. Before beginning to take readings, the patient should make sure the yellow indicator has been reset, resting within the diamond near the mouthpiece. If it isn't, the patient should gently shake the PFM in this manner until the yellow indicator is positioned in the reset diamond. The noise from inside the TruZone PFM is normal and has no effect on the readings. Now, the patient is ready to measure their peak expiratory flow. The patient should take as deep a breath as possible. Put the TruZone PFM mouthpiece in the mouth and seal the lips around it. Make sure there are no leaks between the lips and the mouthpiece, and the tongue is not in the way of the mouthpiece opening. Now, the patient should blow out as hard and fast as possible. The yellow indicator will move in response to the patient's effort. The number on the scale next to the yellow marker is your peak expiratory flow for that effort. Repeat the same technique of taking a deep breath and blowing into the TruZone 2 more times. Note, unlike other peak flow meters, it is not necessary to reset the yellow indicator between efforts. The yellow indicator will be at the highest value of the 3 attempts, and this is your best effort for that session. The procedure is exactly the same for a child. Record this number in the space provided in your TruZone PFM daily record by marking an X on the chart for that date and time. In the alternative, you can place the TruZone PFM directly on the provided TruZone PFM daily record, lining up the scale on the TruZone to the corresponding scale on the daily record. Look at the yellow TruZone indicator and record the reading in the space provided.
The TruZone Daily Record allows you to enter up to 3 readings a day, depending on your asthma management program. Over time, you will create a graph that shows just how or if your condition has changed. Over 2 to 3 weeks, it will also establish your personal best reading, which is your goal to reach when using the TruZone PFM. Your physician or licensed healthcare professional will advise you regarding use of your personal best or published normal peak expiratory flow numbers based on gender, age, and height. You should also record unusual circumstances, such as exercise, other events affecting your condition, and/or what actions you've taken. TruZone Peak Flow Meter can easily be customized by your physician or licensed healthcare professional as part of your asthma management program. The National Asthma Education Program guidelines suggest 3 ranges or zones of peak expiratory flow rates, represented here by our unique color zone tape. The zone system has been adapted to the green, yellow, and red traffic light system to simplify use and make them easy to remember and understand. The green zone is 80 to 100% of your best reading and means all clear. Yellow is 50 to 80% of your best reading and indicates caution. The red zone means readings below 50% of your best and signifies a medical alert. Remember, these color zones are guidelines and should be a part of your personal asthma management program established by your physician. Your physician or licensed healthcare professional should apply your color zone tape. They will remove one tape from the sheet of tapes provided, then peel the backing from the green zone area. He or she will then place the tape in the middle of the True Zone PFM scale, so the arrows below the word best line up with your best peak expiratory flow. They will press the green zone into place, then cut the excess red zone just above the reset diamond, and peeling off the remaining backing, press the color zone tape into place. Now they can do the same procedure on your daily diary page of the instruction booklet. True Zone Peak Flow Meter is designed to accurately measure peak expiratory flow. Remember, you should always contact your physician or licensed healthcare professional if changes in your peak expiratory flow readings show worsening of your condition, or if you experience other changes in your condition. True Zone Peak Flow Meter can and should be cleaned once a week. This too is very easy. Simply wash True Zone Peak Flow Meter by moving it gently through warm, mild, soapy water. Rinse thoroughly and allow it to air dry before your next reading. You can also safely clean True Zone Peak Flow Meter using the normal cycle of your dishwasher. True Zone PFM should never be disassembled or placed in boiling water. For best results, be sure to keep your records up to date. Bring your daily record when you visit your physician or licensed healthcare professional so they can assist you with any questions you may have. Again, thank you for choosing the True Zone PFM. With proper use of True Zone, you'll be well on your way to controlling your asthma.
True Zone PFM has additional 510K clearance for multi-patient use with one-way valve mouthpiece to accommodate its use with more than one patient in a hospital or other clinical setting. Directions for multi-patient use and directions for reprocessing are intended for medical professionals and are available in the True Zone PFM package insert. True Zone PFM meets the most recent standards of spirometry for portable PFM established by the American Thoracic Society and meets National Asthma Education Prevention Program standards. True Zone PFM is another quality product from Monaghan Medical Corporation, the makers of the AeroChamber family of valved aerosol holding chambers and the AeroEclipse breath-actuated nebulizer.